Okay. Hello, Professor Yael Hashiloni-Dolev from the Department for Sociology and Anthropology in Ben-Gurion University and the Center for Health, Humanism and Society in Ben-Gurion University. Could you please share with us your concerns and insights about the corona crisis in Israel?
Thank you. These scary, threatening, strange days of world crisis teach us much about our present societies. The crisis unveils social priorities, social inequalities, and our shared cultural imaginary. Unfortunately, the way the virus is perceived, especially here in Israel, but probably not here alone, is dominated by the language of war, which obscures many important aspects of the epidemic and the correct ways to handle it. We seem to be constantly counting the infected, the ill, the critically ill, but behind those quantitative measures pointed at life itself and their inherent limitations, other factors, less countable, are not seriously taken into account. What are the side effects of isolation? How does it affect different groups in society? What about the women and children who are now much more vulnerable to domestic violence? How does isolation affect the well-being of the elderly, of the poor versus the well-off, and of the newly unemployed? In Israel, the crisis is handled mostly by a small group of health experts and by the army. The social sciences, with all their enormous knowledge, which is highly relevant, are not among the small group of experts who are in charge of national policy. In the tradition of many feminist writers who studied the metaphors used to discuss illness, I want to remind us that the virus is very different from a human enemy. The language of military siege, surveillance, victory, and surrender is not actually relevant. Moreover, it comes with high costs. As the virus seems to be here to stay for quite a long time probably, we better start speaking the language of adjustment, the language of learning to live side by side, of adaptation instead of the language of defeat. Otherwise, how will we handle the next infection or the approaching crisis? Other words that are often used in this emergency are essential needs. But what is essential for society? Who are, for example, essential workers? Surprise, surprise, they're not the ones earning high salaries. Or who are the essential policymakers? And also, what are the vital needs of the critically ill? All the world is now chasing respirators. We seem to forget that in most cases, respirators don't save the lives of people whose medical condition is already grave. Moreover, bringing more machines is useless without having enough medical staff who knows how to operate them and to take care of the patients. So are we really using our resources wisely? Should we point all our efforts at saving lives, or should we also accept the dying process, as death could never be a defeated enemy? More and more people are dying around the world, hooked to expensive, highly complex machines. Yet they're isolated, and no one holds their hand or whispers in their ears. No one gives them emotional and spiritual support. Is this truly how we want to leave this world? Fortunately, a few hospitals in Israel decided to change this, and family members are allowed to separate from their loved ones, with similar safety measures used by the medical team. This seems to be a step in the right direction, as we're all going to die one day, but hopefully not alone, and hopefully not with the care of machines without our loved ones. Saving lives is important, but so is respecting and taking care of the dying.
Thank you.